Hello everyone, we are going to be studying medical terminology in this medical terminology book. Something to learn while going to nursing school. It's important to know these things. It's important to understand the terminologies that we go through. So I'm going to be talking about chapter 3 here for medical terminology. Unveiling the power of word elements. Imagine walking into a doctor's office with complex systems. By understanding the word elements, medical terms, you can communicate your condition clearly, ensuring that your concerns are accurately conveyed. Medical professionals, on the other hand, use these word elements to diagnose, treat, and document medical conditions with precision. The use of standardized word elements creates a common language that transcends geographical and linguistic barriers, enabling seamless communication in global healthcare landscape. Let's start with the word elements one by one. Importance of word elements. In medical terminology, understanding the roles of roots, prefixes, and suffixes, think of medical terms as puzzling waiting to be solved. As the heart of each puzzle and each word is a concept of sets the stage for everything else. Around the root, prefixes and suffixes dance, adding layers to the meaning of the nouns. For example, to understand what cardio relates to the heart, ology means the study. And ist is a practitioner. You unravel the magic behind cardiologists. The essence of the roots in medical terms. Root words are heroes of medical language. They carry the core meanings and serve the foundations upon which terms are built. For instance, the root of derm is all about the skin. It is like the magic word of unlocked doors in various skin-related terms like dermatology, the study of skin. And dermatitis, which is skin inflammation of the skin. They set the stage for prefixes and suffixes, add the plot twist. Then you know the root, you already ahead in the narrative. Let's unveil the real world magic. The word cardio gives birth to cardiology. Cardiology, the heart study. Derm leads to dermatologist, which is a skin specialist. Like the word origami, the word root transforms into multiple terms, have each of its own story to tell, and you, someone starting a career in healthcare industry, are not just reading these stories, you're writing your own one word at a time. So cardio means cardiology, the study of the heart. Derm, which is dermatologist. Arthro and arthritis. Arthro means joint. Arthritis means inflammation of the joint. Endo means within, inside, within. Endoscopy, a physical examination within, inside. Okay, explore exterior and interior root words. Some root words inside are outer facade, while others lie within, shaping the term essence. Just as a building exterior and interior define its character, so that the exterior and interior roots words define the character of medical terms. Exterior, interior, dermatology, cardiology. So, dermatology, the study of skin diseases. In cardiology, the study of heart diseases. In this linguistic journey, these roots are your compass, guiding you through intricacies of medical language. Now let's meet the prefixes. They're like little words that add on to the start of the other words. They attract at the beginning of words and transform their meanings. You think of them as enchantments that give you the extra inside the main word. Certain prefixes like the word go to the magic spells. They appear often like make words look fascinating. For instance, hyper signifies excess, hypo indicates deficiency, and pro favoring supporting. So, hyperthermia, which is high body temperature. Hypothermia, which is low body temperature. Hypoglycemia, low blood sugar. Hyperglycemia, high blood sugar. Prognosis, foreseeing disease outcomes, so futuristic disease outcomes. Ectomy, so ectomy and itis, which means inflammation, and ectomy, which is removal. So appendectomy is removal of the appendix. Dermatitis is inflammation of the skin. All right. And okay, next thing we're going to do is chapter 4. From abbreviations to plurals. Beyond the foundations of root words and affixes, the realm of medical language encompasses acronyms, eponyms, homonyms, and plurals, each contributing uniquely to the precision in healthcare dialogue. This chapter peels out back layers, revealing hidden dimensions where abbreviations transform into meaningful tools, eponyms carry tales of medical terminology, homonyms and elevated linguistic complexity, and the plurals introduce nonsense. Our journey commences with the exploration of acronyms, the gateway to succinct and efficient communication, mastering acronyms and their role in healthcare. If you ever heard of someone talk to getting an MRI in the knee and having a CBC done, you encounter medical acronyms. These shortened forms of medical terms have been an indispensable tool in the healthcare. Let's dive into the word of acronyms. Understand their importance and master their use. An acronym is a type of abbreviation form initial components of the word. For example, MRI stands for magnetic resonance of imaging. An acronym is a type of abbreviation form initial components of the words. For example, MRI stands for magnetic resonance imaging. CPR, ECG, ICU, CT, and CVC. So CPR is cardiopulmonary resuscitation. ECG is electrocardiogram. ICU is intensive care unit. CT is computed tomography. CBC is complete blood count. Acronyms versus abbreviations versus initialisms. These three types of sound may say the same thing, but there's differences. Abbreviation, doctor, shortened form of the word. Initialism, DNA, deoxyribonucleic acid. Initials spoken individually. Acronym, AIDS, acquired immune deficiency syndrome. All right. Obeying the words of eponyms and their origins. Eponyms are like fascinating historical footnotes scattered throughout the medical lexicon. They tell tales of pioneers, discoveries, and stories that have shaped the world of medicine as we know it. But what exactly are eponyms, and why are they so prevalent in the medicine? Derived from Greek word epi, meaning upon. oma meaning name, as the eponym is essentially a person, place, thing, or thing after something is believed to be named. The role of eponyms in medical languages. Eponyms. Historically, many medical conditions instruments were named by physicians or scientists who discover them of sometimes the most famous patient associated with the condition. The method serves as a form of acknowledgement as a respect towards those who have advanced in the field. Origins of the stories behind popular eponyms. Alzheimer's disease, named after Alois Alzheimer, a German psychiatrist and neuroanomalist. First described a disease in 1906, examining the brain of a decreased patient with unusual patient brain abnormalities. Parkinson's disease, detailing the major symptoms of the disease. Achilles tendon, which is named after a tendon of eponymously named for Achilles, a Greek mythological hero, is believed that the mother dipped in him river Styx by his heel to make him invulnerable, which is the heel tendon bear his name. Fallopian tube, which is an autonomous Gabriel Fallopio. These tubes play the pivotal role in female reproductive system. Okay. So, in dermatology, a patient referring to a lesion might be alluding to the insidious mole or a suspicious melanoma. Contrast to orthopedics, where is a reported lesion in the cartilage could be suggested traumatic injury or degenerative change. Similarly, the word cold could be multifaceted descriptor. In clinical parlance, a patient complaining of a cold might be present with rhinorrhea and pharyngitis due to upper respiratory infection. However, in a casual setting, the same term might merely denote a dip of ambient temperature. All right. So, for example, appendixes. A Greek-derived word for a diagnosis, the suffix to transfer into s. The pluralized, thus the multiple evaluations might be several diagnoses. Latin-rooted words appendix will be changed into x. This book has supplemental material at the end, contains the multiple appendices. Fungus, fungi. Vertebra, vertebrae. Matrix, matrices. Bacteriums, bacteria. Viruses, viruses. Bronchus, bronchi. While bacterium is in singular, the plural isn't bacteriums, but bacteria. All right. Well, that will conclude this of Chapter 3 and 4 of Medical Terminology, and we will talk about further medical terminology next time. Thank you, everyone. Have a great one. Bye-bye.